Dr. Brayton and Jayne Freeman and I are really excited to just discuss how to build a birth team, why it's important, the value, what does it mean, and really, kind of the whole purpose and our passion specifically about helping to support women preconception through motherhood. Jayne and I think, and I'm going to speak a little bit up for you.
Sure.
But we both love working with women as early as possible with this type of situation. And we were even discussing as we were planning the talk tonight, we're like, we don't know if third trimester women are coming, first trimester, second trimester, preconception, like there's a whole range here with all very different needs. But earlier in the pregnancy, or even not pregnant yet, is really ideal to start getting this information and education, because you're just more empowered with the choices and decisions that you make going forward.
Right.
So we're really happy to have you here.
Yeah. So we thought about how to define what does it mean to build a birth team. That was one of the first things that we wanted to talk about. What does it mean, and why is it so important? Because as we know, lots of people just kind of go into it in a very haphazard way. They don't really think too much about it, and as they learn a little bit more as they go along through either preconception or through their pregnancy, certain things come to light that make them say, oh, I wish I had known about that earlier. And perhaps certainly on a second pregnancy, you kind of have a little bit of that hindsight where you say, oh, okay, now I do have an opportunity to do things a little differently. So when we talk about building a birth team, how do we define that? I feel that it's a combination of your support team from top to bottom. Some of that is clinical, some of that is emotional. It can be all over the place. It can be specific to your physical needs or your emotional needs, and just in general, just ways to feel well supported in your pregnancy. I'm going to call it perinatal, right? So we have before, during, and after. So through that whole arc of change that you're going through. One of the things that I experience with, I've been teaching for a long time, so I see couples when they're close to delivering, they're at the middle to end of their third trimester. And one of the things that I notice, the prevailing emotion that a lot of women have is, I just don't get enough attention from my practitioner. I don't have enough time. When I go for my appointments, I feel rushed. I don't feel like she's in the mood to answer my questions. Sometimes I just don't even know what my questions are, until I'm like outside of the office. So that's part of having your team, is to know who to speak to, and they can often refer you to other people. So how does that seem to work for you in pregnancy, let's say?
Yeah, definitely. So it is true that traditional birth providers like OBGYNs, for example, they really only have 10, maybe 15 minutes per appointment, and it feels rushed sometimes to be able to answer a lot of questions that you may have, especially as a first-time mom. And as things change throughout your duration as well, because different things come up during that period. So when you work with other types of practitioners that are part of your birth team, there's an opportunity to have more of these conversations. You're not necessarily feeling like you're getting all your information from the internet, which may or may not be accurate. And if these other practitioners can't answer your question, then they're going to be helpful in making the appropriate referral to someone who can.
Right.
Or other resources, perhaps. Maybe being able to direct you to resources online that are vetted and reliable.
Right. A great example of that is something Laura deals with all the time, which is a baby in a breech position, right? This is extremely common, that a baby is not in a head down position, might be bottom down, might be sideline, whatever it is. Sometimes a practitioner will just have kind of an attitude. We'll just schedule the C-section for you, as though you don't have any options. Right. Now, if you didn't know, if your practitioner didn't refer you, and you didn't do your research, or you didn't have a team that might say, there is an alternative to going straight to a C-section, for example, chiropractic. So how does that happen?
Yeah.
How do people come to you?
Well, I happen to bring my handy little spine with me today. specific visual because chiropractic is hugely helpful during pregnancy and after pregnancy, and it also helps with fertility as well because our spine is made up of all these vertebrae, and the spinal cord runs through the column, and now at every single level you see these little things coming off, and they're nerve roots, and they go literally to every single part of our body, and it's how our brain, which sits here in our skull, communicates with the rest of our body. So when a vertebrae is out of alignment, what we call subluxation, and it could be multiple ones, and especially in the pelvis area, which impacts pregnancy very much often, it will impact the function of the nervous system. So it's really wonderful to work with women to help support that. But to specifically answer Jane's question regarding a breech or transverse presentation in third trimester, chiropractic using the Webster technique is highly valuable at helping that baby turn. And it's because we know anatomically, this is the sacrum or the tailbone, which we can see back here, but in the front of the sacrum is where the uterus attaches. And so if a woman's sacrum or whole pelvic canal goes out of alignment, which is super common during pregnancy because the relaxin hormone is released in a woman's body at conception and allows all of the ligaments in her body to loosen in preparation for birth, which is important because this pelvis literally has to open for the baby to come through the birth canal. But what happens is the sacroiliac joints, which are located on either side of the sacrum, are only held together by ligaments, and those joints can become really easily mobile, or what we call hypermobile, and create inflammation and pain in that area. That certainly will create some back pain and possibly even pain referring into the woman's leg or buttock area, but it can also impact that baby's position because when the sacrum moves out of alignment, it can create what we call intrauterine constraints. So if we pretend that there is a baby sitting in here, so the baby can get pulled to the right or the left side, and sometimes you might have even seen pregnant women in their third trimester where like their whole belly is like shifted to one direction, and that's an indication that there's a lot of tension in the uterus and all the ligaments that are supporting the uterus and the womb. So there's a lot that can be done from an alignment perspective with that mama's pelvic alignment that can actually release that intrauterine constraint and create space for that baby to turn and go head down. And what's cool is in my practice, my associate and I are both Webster certified, and we're about 85% effective in helping these breech babies turn. But once again, to Jane's point, I would love to see women a little bit earlier in their third trimester for this technique. There's a little more space, the baby is smaller, and we also have a little more time because, nowadays, it's standard of care that if this baby is breached at like 39 weeks, they're going to schedule that C-section for 39 weeks to happen. So if a woman comes to my office at 37 weeks, we have like 2 weeks to work with. If she comes in at 34 weeks, we have 5 weeks to work with. So there's more time there, right? And so that's what we want to, that's obviously preferable. So it's helpful to have your spine checked and aligned, but especially when it comes to like the position of the baby, which really can be a musculoskeletal issue. And I do find that like a lot of midwife providers, practitioners, are really on top of making referrals to a chiropractor for the Webster technique, as well as to acupuncture, because that can also be beneficial. But sometimes the OBs just aren't either aware or they don't think it's important, and at the end of the day, it's always nice to have options as a patient, right? And to be educated and knowing, like, maybe you don't want a C-section, and okay, your baby's breech, what else is out there? What else is possible from a safe, non-invasive, and effective manner? And, even the next step after that to help avoid a C-section could be an external version, which is performed by an OB in the hospital after 37 weeks, and it's a lot more invasive than chiropractic and acupuncture.
And has a lot of risks.
And has a lot of risk. It can induce labor, which is why they wait till the baby's full term at 37 weeks. So this is so much more gentle and effective, and doesn't carry those risks of inducing labor or other issues.
Okay.
Yeah.
So there's a couple things I wanted to say in reference to that. So just going back to like how you build your team, you really can start in one spot. You can start with one contact person who you either went to for a class, for a consult. So a lot of people start with a childbirth educator, or they're already thinking about having a birth doula. So she's always a really good resource for referring you to lots of different alternative ideas. This is what birth doulas do. They get you ready to have the best birth experience you can possibly have. So they're the ones who are going to know who the physical therapists are, who the nutritionists are, who the chiropractors and acupuncturists are, even who the childbirth educators that they might want to refer you to, and even moving forward into postpartum doulas, because not all birth doulas, in fact very few of them work as a birth doula and a postpartum doula. So we have overlapping fields of the birth world that frequently refer to one another. So if you start in one spot, that one person can connect you to so many people. Unlike maybe the obstetric model, we kind of work in the opposite model where we think of it as this all-inclusive, more holistic way to look at your pregnancy and your labor and what happens afterwards, because we know that not one person can handle all of it. So there's just a different philosophy behind it that I think is really important to be aware of. There's something else that Laura said that just like reminded me of how many people I've talked to in my classes who talk about pain that they have when they're pregnant. I just mean ordinary aches and pains that women experience. It could be all over their bodies. I mean, it could be, centering from their back, and any misalignment can create aches and pains elsewhere. And what they're typically told is, oh, you're pregnant, you'll feel better once you have a baby. I'm not making that up. I've heard that countless times. And that's, to people like us, that's really disheartening to hear.
It's really disheartening.
Because there are answers to that. There are ways to fix that problem and to not suffer through it.
Women do not have to suffer during pregnancy. It's not normal. It may be common, but things that are common are not normal. So women can actually feel healthy and have vitality and energy, and really actually thrive during their entire pregnancy. And that's what's possible for every single woman. But it does sometimes require lifestyle changes, stress management, and perhaps changes in work schedule and support from other people. Getting regular chiropractic care is a huge part of that because it is addressing alignment. And to Jane's point, it may be a neck or back pain issue or headaches that, I see a lot of that with my pregnant patients, but it could also be less swelling in the hands or feet, which is also common in the third trimester especially. And this is something that chiropractic can also impact because the ankles or the wrists can be out of alignment, and that's impacting the lymphatic drainage and flow of the body. And if we remove those blockages to the flow, everything's going to function better. So a woman's digestion is improved. So she has decreased to no morning sickness symptoms, which is hugely helpful, especially first trimester. Reflux and other types of symptoms that can happen later on can be improved with the adjustments. And the other powerful thing for pain relief for pregnant women that's drug-free in addition to chiropractic is acupuncture and prenatal massage. So these three modalities can be hugely helpful for a lot of common pregnancy-related aches and pains that you were mentioning. And women don't have to suffer with them. I mean, I've literally had women in my office that, were so much back pain in their third trimester, they walk in with canes, which is really horrifying to see. And it's because their pelvis was so unstable that they just literally needed that support. And we get them adjusted, aligned, put a belt around them to help secure their SI joints and their pelvis. And they're off that cane within 1 or 2 sessions. So it's powerful in its quality of life. And, it breaks my heart when women come in and be like, I just can't wait to deliver this baby because I feel so uncomfortable. And it's not the best mindset to have during a pregnancy. It's really about ideally cherishing this really finite amount of time of pregnancy, which does end. Nobody stays pregnant forever. And kind of rushing to that finish line of wanting to just get this baby out of me is just not ideal. Yeah.
I was thinking about the concept of a birth team. Like I feel like this is something that is a newish concept, and just the idea of having like several different professionals and specialists.
Mm-hmm.
So recently I was working with this couple. They hired me to be their childbirth educator, and I did a private class with them. And the husband worked for the Department of Defense. So he had this very sort of analytical way of looking at pregnancy and birth and so forth. And he said to me, "This is what we do in my job. We create SMEs." I was like, "What? I'm sorry, what is that?" He's like, "A SME. A SME, a subject matter expert." Is this familiar to you, this term? I'm like, a subject matter expert. He's like, "This is what we do." He's like, "Every time we embark on a project and I'm managing the team, I have to put together the subject matter experts." He's like, "So that's what you are. You're the one for the childbirth education, and then we have the birth doula for a different piece to this, and then we have somebody else for something else." And I thought that was it's a very sort of clinical way of looking at it, but it makes a lot of sense.
Logical.
Yeah, and then he said to me, he's like, "I don't know how to do this. I'm not an expert in this area." He's like, "Look, I'm taking a class, but I don't know 1/10 of what you guys know." So I that's always stuck in my head, that idea of finding the experts around you and recognizing that not one of them is going to be, the be all and the end all, that like everybody can do different things and help you in different ways. So the referring is a big piece to it. There's certain pieces to what goes on in your pregnancy and your labor and afterwards that, you just would have no idea about. I'm thinking of an example of, like birth doulas, for example, right? If you're a birth doula, you want your client to have a good, effective birth, because if her body isn't working effectively, that's going to mean more interventions, and more interventions, we know, leads to more complications, which eventually can end up being a slippery slope to a C-section, right? Which is something a lot of women want to avoid. So birth doulas are really good at making sure that you've got all the pieces, lined up, and part of that is, I've heard some birth doulas describe this as like, we want that pelvis nice and flexible and open and in alignment, so we create like a chute, basically, for that baby to come right out. And those are the births that are under 20 hours, that are uncomplicated, that don't require all these interventions that go on in the hospitals.
No doubt. I see that over and over again in my practice. Women that, are getting adjusted, they're physically fit too, like they're doing strength training exercises throughout their pregnancy. They're mentally fit, right? Because birth is also very mental. So they're really learning how to move past the fear and surrender, which is hugely important during the birth, so everything can open. And they have really amazing births that don't require interventions, and they're very fast. I've even had first-time moms 6-hour labors. Like, that's what's possible.
Yeah.
It does exist. So, I think it's important for women to know that this is available and out there, and if one woman had that experience, you can have that experience too.
So true.
Yeah.
I was thinking of my sister, because she's like, she didn't do anything, and she had the baby within an hour. Like that.
Her first baby?
Her first baby.
Oh,
That's very unusual.
She didn't go to any breathing class, nothing. She's like, whatever, it's gonna be fine. Boom.
She certainly wasn't holding on to any fear.
And she wasn't here, she was in Argentina, right?
No, she was in Miami. Well, not here, but in Miami, yeah, so it was funny.
Fear plays a big part in issues for women. We have an amazing hypnotherapist in my practice in Hoboken, And
Yeah,
he specializes in hypnobirthing, and he does one-on-one sessions with women during their pregnancy and really helps them learn how to release that fear of the upcoming birth, which is a pretty common fear for a lot of women, first-time moms, but even sometimes second or third-time moms who may have had traumatic birth experiences. And that gets wired into that woman's nervous system, and it's really hard to release that. So doing hypnotherapy can go very deep to the subconscious mind and literally replay that story to the story that you want to create for your birth. And over again, we've seen women that, let's say, went down that slippery slope with their first pregnancy, had an emergency C-section that they did not want to have, and now with the second pregnancy, they're able to have a successful unmedicated VBAC that is exactly the birth that they wanted to create, and they give him a lot of credit for that. So that's another member of the birth team that can be hugely helpful to address the mental game that is part of birth.
Yeah.
Yeah.
You know, speaking of the emotional part to it, I was thinking about how when women are visiting their various clinicians, they're going to the lab, they're seeing their doctor and so forth, it always strikes me how cavalier a lot of people who work in the birth field on a very clinical end are about pregnancy. To every single woman who walks through the door, this is an amazing thing that's happening to her. This is the biggest thing that she's ever experienced. And then you have all these people who just treat you like you have an ingrown toenail or something. It's just like, it takes...
It's a lot more magical than that.
It really takes the wind out of their sails, I notice. You know, when they're like, the staff maybe at the office, the doctor's approach to things, the lab technicians. I wish there could be a class for lab technicians to take that just helps them deliver information in a less tone-deaf manner. Sometimes they're just like, oh, okay, I see one kidney here, I better go get the doctor, you know, or just whatever. They just like blurt out information in a way. I mean, that's, you know.
Oh yeah, we've had all that kind of jazz.
Yeah. Yeah, and
I mean,
that's why.
even on the phone, leaving a message saying,
Yeah.
"Oh, you have a polyp." About I'm
Exactly.
like, what does that mean? I didn't sleep all night. Like, I'm like, what? Why
Exactly, that's a great example too,
Yeah,
right? When
like,
they
I don't
leave
know
you
what
a message about some important medical information without any follow-up to it, any explanation.
Right.
Even
no
a
give it
couple
a
of
reach.
words of reassurance, like, don't worry, this isn't a big deal, we just want to let you know, blah, 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 blah.
Right.
So we don't see that a lot with our average practitioners, and I think that's another reason why women are craving this kind of support team, so that they can lean on somebody who's empathetic about what they're experiencing.
Yeah.
And you know, people like us that work in this birth arena, like, we can never get tired of it. It's endlessly fascinating
Yes.
to us, and we're constantly feeling that newness, that freshness of every new birth is so important and special to every woman who's going through it.
Yeah.
And no, it's not a conveyor belt of like, you know, next, you know, I just, I
It's a
find
new
that very
life.
disheartening.
Sorry, what?
It's a new life.
It's like the
You
most
know?
important thing that a woman will ever do. You know what I mean? You're creating a new life, to your point.
Yeah.
You know, Robin Lim said it well. It's the most powerful initiation, spiritual initiation a woman can experience is to birth a baby. So I feel like there's a sacredness to that that can be lost sometimes in the medical community, and that's what's really exciting about having a birth team. Some of the members are not medical, right? And they offer that sacredness, they offer that spiritual component in honoring what's occurring here and cherishing and celebrating it, which I think is just so important.
Absolutely.
Yeah.
I'm always telling people, I'm like, look, your doctor is not there to support you emotionally. That's just
Right.
not what
Yeah.
they're there to do.
Right.
And I will say, in all fairness, that even with midwives, which people think are a little bit warmer and fuzzier, yes, they frequently are, but they're also not there to hold your hand through your entire labor and so
Right.
forth. That's just not what they do.
Right.
And so that's another reason why a birth doula is so critical to your experience, and why the studies show us that we have women with fewer complications, fewer needs for epidurals, fewer C-sections when they work with birth doulas. Now, this isn't because the birth doula has some magic wand that makes those things go away. It's a combination of support and clinical experience. And I know birth doulas are not technically clinical. They can't do anything clinical. They're never checking your cervix or your blood pressure or anything. But there were these OBs in New York who said to me once, I was attending a workshop that they were giving, and we were talking about a particular doula, and they were like, "Oh, we learn a lot from her."
Wow.
I was like, oh, did I just hear that correctly? We learn a lot from her. They were having full respect for the doula's experience level.
Yeah.
And again, a non-clinical experience level, but such an understanding of birth that it was, they just recognized how powerful that is. And in fact, that practice, if you join that practice, you are expected to hire a doula. They insist basically that you have a doula for your
At
birth.
the end of the day, they make the job easier for the doctor.
For the doctors, right.
There's no doubt. I mean, and I would say chiropractors do the same thing too. We make birth easier on OBs and midwives, whoever's catching the baby.
Right.
So it almost just, to me, would be like this is what you should do, because my job's easier. I have lower malpractice, right? I have less risk. I have all that stuff combined because of this birth team. Birth teams are really about, so it's like the OB doesn't have to feel like all the weight is on their shoulders,
No.
right?
This team in particular, they put a lot of responsibility on the doula.
I love that.
I remember her,
Yeah.
one of the doctors saying to me, she's like, we look at the charts, we look at the fetal heart rate tracings, and I'll say to the doula, you see where this is right now? It's your job to keep it there. Like that kind of a thing.
Wow.
So she knows that when she leaves and she goes elsewhere, whatever this doctor is doing in the hospital and so forth, that the doula's got it under control. And that if she sees that heart rate dipping and so forth, and that's a very, very common reason that women are ending up with a C-section. Fetal heart rate variations that are troubling to the practitioners are one of the main reasons, one of the main drivers into C-sections. And why that happens, sometimes it's just natural and organic, like the baby is pressing on the umbilical cord and that's causing a drop in the baby's heart rate. Sometimes it's due to medication, epidurals, Pitocin, all of those things can impact the baby's heart rate, the mom's blood pressure, all of those things. So when you have a doula like helping to navigate that, a doula knows that like, okay, let's shift you to your other side, for example, and that can change everything to the positive. So there's no need to
Yeah, changing positions. Maybe if she hasn't had an epidural, walking around, being active, just, to your point, the baby is maybe in a distressed position that could be related to the woman's musculoskeletal alignment, and she can hopefully correct that and change it, yeah.
And that's a little adjustment that can be made, you know?
Right, and it's actually, once again, kind of goes back to that common sense. Like, there's a reason this baby is having some distress, so what can we do without just rushing to that C-section to see if you can make a change? Yeah. So birth doulas are huge. I know postpartum doulas are also hugely valuable. And Jane, as a postpartum doula, do you want to talk a little bit about that role?
Well, it's funny because we spend so much time thinking about all the different things that go on in pregnancy and concentrating on birth. Some people take birth classes that are many, many hours long or go on for several weeks and so forth. And we don't really spend the equivalent amount of time on what comes after.
Right.
My analogy for that is like, we taught you how to get out of the driveway with your car, but we didn't really teach you how to drive. And so although I teach breastfeeding support and I teach baby care, infant care, and so forth, I know from firsthand experience that when you come home with your baby, like all that other stuff you learned is largely theoretical. When you come home from the hospital with the baby, the questions that you have are just absolutely endless. You have this new creature in front of you and you just did not get the manual that comes with it. No matter how many books you have and how many good websites you looked at, your baby and your experience with the baby is so individual, so specific and subjective, really. So you have to learn your baby, and
every baby's different too.
right. So there is no
just
like
first-time parents.
there's no like textbook, that although it is helpful sometimes to see things in print that validate what is happening with your baby at any given time. So anyway, as a postpartum doula, there are so many things that go on, and I work with parents all the time, just helping them transition into this new phase in their life that hopefully gives them a lot more self-confidence and just the ability to recognize what are the possibly serious issues and what are the things that really don't matter, like diaper changes and those kind of things. The main issue really is, my emphasis is feeding. Breastfeeding is definitely challenging. And although it may come naturally to some people, it is not without its little ups and downs and hiccups along the way. You can have low milk supply, you can have a difficult latch, you can have a baby who's having some physical problem with their mouth, with their tongue, and so forth that will impact your latch. Milk supply is another issue that impacts so many women, and a lot of that has to do with what type of birth experience they had. So that's something a lot of doctors don't talk about. When we talk about the risks of C-section, for example, that's something that can be, your breastfeeding relationship can be impacted by what happened to you during your birth. And certainly having a surgical procedure and blood loss and trauma to the body, of course that's going to impact you afterwards. So there's this sometimes notion of like, okay, no big deal, baby came out door B instead of door A, and everything is just fine. So,
and typically the baby's not immediately put on the mother's chest.
Oh no, that's
after
rare.
C-section either. Like it would be possibly after vaginal delivery, and that can also impact that bonding, connection, and breastfeeding experience.
More and more hospitals are starting to do this. They're terming it a gentle C-section. It's not exactly like the perfect terminology for it, but it's certainly more gentle than whisking the baby away and keeping the baby separated from the parents for a long period of time while the baby is being assessed and so forth. And then, in fact, what happens, even if the baby's perfectly fine, is the baby typically goes back to the father or the partner, and the mom doesn't she doesn't have any ability to connect and bond with her baby. The operating room is not really designed for that, and that's probably where doctors were, that's how the whole protocol came about. That, here, baby goes to the dad leaves the room, mom gets, her incisions closed and so forth. So now there's a little bit more of a trend to try to place the baby on the mom's chest while her incisions are being closed, which can take up to an additional half hour after the baby is born. So it's a significant amount of time that you get to really connect with your baby and have that flow of oxytocin make a difference for you, the baby, the breastfeeding relationship, even healing. So all of that is very important. And again, I'm going to say like 3 years ago when I had students asking about this, it was a stretch to get their OB to say, okay, we'll try to do that. And now it's being talked about more and more.
That's great.
So, and that brings me to the hospital that you choose. So, we have in this area, NYU is one of the few hospitals that's baby friendly, and that means they're going to make every single effort possible to protect the breastfeeding relationship, and that includes skin-to-skin contact as quickly as possible, keeping mother and baby together, promoting breastfeeding, and a whole bunch of other protocols that are geared around breastfeeding specifically. Yes.
Are you seeing less of them cutting the cord so quickly? Because I know that for they're so quick to
Well, that's
back
the
in
way,
the day, right?
That's
And
the
I
way
feel-
OBs were. That's what they learned.
Yeah.
Right.
Do you
And
feel
since
like
the
it's
beginning of
changing?
obstetrics?
Do you? I mean,
It's absolutely changing.
Yeah.
But it's a funny thing because things tend to move very slowly in obstetrics, particularly with hospital protocols. And this is something that has really gained momentum. And I credit that really to more people
Midwives and
being,
doulas, yeah.
well, just more people being advocates for their care. Couples coming in and saying, hey, we heard about this, no matter how they heard about it. Maybe
Yeah.
they just saw a TED Talks about it,
Yeah.
or maybe they heard it from their childbirth educator, or their doula, or their chiropractor, or whomever.
Right.
And now they've learned that there's a benefit to it. So more and more OBs are being a little bit more inclined to
waiting.
to wait. So delayed cord clamping has to do with just a small delay. It could be as small as 90 seconds, all the way up to 3 to 5 minutes. It depends. But the whole idea is that part of the baby's blood volume is still outside of her body at birth. And so we allow that blood volume to come into her body. It's almost like a blood transfusion, or it's actually an infusion because it's her own blood. So that blood is oxygen rich and it's iron rich, and it's beneficial to her right in the moment and beneficial moving forward in terms of the iron stores that she's getting from that blood. So there are not really a lot of good reasons not to do it. You don't want to hear a doctor say like, oh, I just don't do that. Which
Or the
has
cord
happened
bank.
before.
Well, maybe it's the empowering yourself to speak up and ask for what you
Absolutely.
want.
Sure, people will ask for it, but that doesn't mean that their OB will do it. You know, there's a little bit of a push-pull there sometimes. I was just talking about this with one of my clients today, because they were like, well, we asked for blah, 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 and the OB got mad. Like, they literally saw her, like, face change, and she shut down. And, you know, I said to them, I'm like, nobody likes to be told how to do their job. Right? And so on one hand, we have this sort of empowerment for couples who are having babies and just being like, okay, I know so much more, and now I want to come to my doctor and say, I really want you to do delayed cord clamping. Have you heard of this? And it's like, they're an OB. So on one hand, they're doing things a little bit more slowly than we would like to see change occur. But on the other hand, you don't want to get into like a combative relationship with the person who is your provider. You want to have a trust and, a nice relationship with them. And if you're really, sort of butting heads, this is not the correct provider for you.
Right.
So,
Potentially you find
No,
that
that
out
makes
earlier in the pregnancy rather than later.
Right, because you can't switch later on. It's not
Yeah.
possible, so. Anyway, yeah, so that's a whole other tangent. Are there any questions on those topics or anything relating to that?
Because for me, it feels like so far away, so I'm not even like thinking
Sure.
about that. But it's really interesting that you're sharing that.
And you raised such a good point about being an advocate. I just recommend that to everybody, whether you're pregnant or not. You have to be your own advocate.
Well, I'm a women's empowerment coach, so I help women.
Awesome.
And to your point, what you were saying about asking is not demanding. There's a difference between asking and demanding.
That's right.
So, sometimes we just don't know how to ask.
Yeah, I'm curious how that couple asked, right? Like, what was the tone?
It's interesting. It's interesting because even I'm seeing her right there. So Dr. Thompson, that's
That's your doctor?
That we went to see her, and so I'm like, she's looking at me. But I was like, it was really fun because whatever, nothing is perfect, and again, they're doctors, right? Like they're scientific. Well, they're scientific too. That like sometimes they forget. But I remember even since the first time, I was like, okay, so this is what would work for me. And again, I'm not telling you what to do, but I like to play with some magic as well. Like, and I'm using terms that they're like, maybe. But she was really open, right? Like from the beginning, and you still hear what she still tells you, but at least she's understanding.
She's open.
When you have an approach that serves you, and when you can speak up your truth without having to tell others what to do, but it's just coming from you, the experience also changes. So it's just really interesting what you're sharing, and it's just a good reminder. But we do have the power.
Yes,
To
we
ask.
always do, and we have the, ideally have the awareness as women to not give our power away.
Yeah.
So thank you for mentioning that as well. I think that would serve women in every area of their life. But pregnancy, birth, and parenting are lessons for women, I think, and opportunities for growth and how to speak their needs and to communicate in a feminine way as well.
Right. And then I think that what you're saying is like, for me, this is totally new. So it is disempowering because I don't have the information. Not because I'm not empowered or because it's just a new thing.
Right.
So it's good to have guidance that has me like, I had to call my friend who has 3 kids the other day because I'm like, okay, what do you think I should ask? Or what do you, that kind of stuff. And so she just helped me sort of get a little bit more into what I needed to ask for. So that's just good to have. I feel like that's what you're talking about, to have a team.
Yeah. And once again, within the team, some of us are going to have different expertise, right?
Right.
So we don't all have the same answers and the same expertise and in different subject matters. So just because we know a lot about birth, there's still different components to that, right? And that's what's the beautiful thing of having a birth team, because you can get that support from multiple different angles.